Good evening, and welcome to the presentation of Living with Chronic Illness. As nurses, we have a duty to assist those in our care to be able to care for themselves and their health. Individuals living with chronic illnesses are especially in need of education and guidance due to their complicated health situations. The interdisciplinary team needs to work with the patient and their support people so that they can learn to manage their illnesses and attempt to use primary care and specialists as opposed to the emergency room and prevent hospitalizations. These admissions can be very costly, adding another burden to them as well as the insurance company. Many insurance companies have nurse navigators who help with patients who have conditions that need extra support. Our author discussed the importance of key stakeholders and health policy which dictate what access our patients have in healthcare services. My name is Colleen Wilkie and I'm a registered nurse in the Commonwealth of Pennsylvania. I currently live and work in the Philadelphia suburbs. I'm happily married and have two sons, Jose Dario and Brandon, ages 24 and 14 respectively. We are a Scout family. My husband and Jose Dario are Eagle Scouts, and Brandon is a Life Scout. I've worked predominantly in long-term care for the past 25 years. Prior to that, I worked in social services at Georgetown University Hospital after I graduated in the 90s. Currently, I work in a life plan continuing care retirement community as the clinical educator and the infection control nurse. I love my job. I so appreciate working with my new team members as well as our patients and residents and their families. I see patients daily with a multitude of chronic illnesses, and empowering them and their families to keep them out of the hospital is a very important part of my job. What is the illness experience? I'm going to define the difference between illness and disease, discuss the holistic needs of our patients, especially those with a chronic illness, and demonstrate the educational needs of patients living with these illnesses. Our author discusses the difference between illness and disease. Disease, quote, refers to the pathophysiology of a condition. Illness, in contrast, is the human experience of a disease and refers to how the disease is perceived, lived with, and responded to by individuals, their families, and healthcare professionals. Illness is the social meaning of the disease. As nurses, we need to remember the important mindful presence to listen to our patients and their families, to support them through the ups and downs of living with a chronic illness. There is no cure. There is only positive self-management to stay healthy. There are many needs for the patients, including physical, emotional, mental, spiritual, and financial. We need to be aware that the individual's needs are going to change over time, sometimes each day. We have to work with them to support them and put them in control of their conditions and their body. Our author discusses the importance of educating the patient and their family so that they do not need to let the illness consume their life. Social isolation. Social isolation is defined as social distancing. One best practice nursing for a child with hemophilia is pain control. I think the most important nursing intervention is education on the importance of physical activity to help control their chronic pain. Social isolation is the distancing of an individual psychologically and/or physically from their network of desired or needed relationships with other people. Specifically defined, social isolation is a state, quote, in which the individual lacks a sense of belonging. Society lacks engagement with others, has a minimal number of social contacts, and they are deficient in fulfilling and maintaining quality relationships. Hemophilia is an uncommon disorder that is difficult to diagnose and manage. While bleeding events in people with hemophilia is usually lifelong, they often occur in muscles and joints. I read an article that emphasized the importance of physical activity for children living with hemophilia. As a nurse, we need to teach the patient and their family the importance of exercise and reduction and control of pain. I read an article on the importance of recognizing the varying levels of pain in patients living with hemophilia. Children would probably benefit from the Wong Face Pain Indicator Scale as opposed to the traditional 0 to 10 pain scale. As a mother of a child living with a connective tissue disorder who experiences joint and muscle pain, I feel such a connection to the child in this case study and their family. I'm fortunate to live in the Philadelphia area with 3 children's hospitals. Not all families have this same access to specialists. What is health-related quality of life? Health-related quality of life is the measurable effect of chronic illness on an individual. Some of the best evidence-based practices are interventions to assist with these chronic illnesses. They are measurable. A nursing intervention for one of these patients would be detailed education on the process of a recovery from a stroke and what to expect, caregiver support and education for the family, teaching them about burnout and providing help with community resources is going to make the life better for the patient and the family. Our author discusses the difference between quality of life and health-related quality of life and emphasizes the importance of not using the terms interchangeably. Health-related quality of life looks at the individual in a holistic manner as someone who has many needs and how their chronic illness affects them and their daily life. Measurable evidence-based practices are the key to having a positive outcome for the patient and their family. There are many tools available for nurses and other members of the interdisciplinary team to measure the effectiveness of the interventions and treatment plan. Quote, managing chronic illness raises the nursing practice bar, challenging nurses to apply a caring, patient-focused, systemic outcome-based, cost-effective quality care model. The 60-year-old client with the recent stroke is such a tragic case. The family's life will be forever changed. Caregiver support is going to be the most important part of the care plan. The patient will have an interdisciplinary team with nurses, therapy, social services, a registered dietitian, and others. However, the caregiver will not have all of these supports. Most of the time, it falls on social services for finding community resources for the patient, and nursing is the predominant educator for the caregiver. Financial support is also going to be important for this family. If the patient was the family's primary breadwinner, they may not have the means to care for the patient in a safe manner. Does the patient have short-term disability? Do they have adequate health insurance? The added medical expenses from hospitalization, post-acute rehab, and home care eventually will have an impact on the entire family. The family is going to need education on what to expect from the stroke and how it will affect the patient. Physical limitations, the need for assistance with activities of daily living, such as dressing, toileting, eating, and bathing. There may be language and communication deficits as well as visual changes. The patient is also going to need emotional support as they will inevitably feel guilty for the added burden for their care needs on the family. Powerlessness. Powerlessness is a profound feeling that at its core can result in many emotions, ranging from anxiety, fear, and uncertainty to hopelessness. The best nursing practice intervention is empowerment and stress reduction education. This family and patient of the 20-year-old suffering with schizophrenia is going to need education on the importance of medication and compliance, counseling, and stress reduction. Schizophrenia is one of the most disabling mental illnesses, which is characterized by impairments in the cognitive, perceptual, and emotional realm. The onset of this illness usually takes place only in late adolescence or early adulthood. I truly believe that the most important nursing intervention and best practice is empowering the patient and their family. Mental health is such a neglected area of healthcare for a myriad of reasons, including negative social stigma, embarrassment, lack of mental health care services, and subpar health insurance coverage for the services. Patients often have to wait months to get an appointment and then hope that they have a good fit with their provider. Often, especially those on Medicaid, cannot find a provider that is taking their insurance due to the low reimbursement rate that they receive. This is so unfortunate, and as nurses, we need to ensure that the mental health needs of our patients, especially those with a chronic illness as serious as schizophrenia, are getting the support they so desperately need. We need to listen to them and let them know that we are there for them. We need to ensure that they are compliant with their medications, taking it daily, not just when they feel well. T represents the presence of a therapeutic intervention, which is defined as an intervention on the part of a third-party practitioner, including nurses, that's intended to improve the patient's physical functioning and psychological well-being. H is habit forming. It takes 21 days to create a habit, and we need to work on that. And as nurses, we need to have our interventions in place that do foster that improvement. We need to work on internal and social factors. We need social supports that include help for our families, help for the patient. It's practical. It may include financial, it may be social services. That's what we need to do. I is individual differences. We need to work on the patient-centered, focused Medicare, Medicaid policy. Every person and every person includes a need and what we need to do for them. These are values and beliefs. They are holistic beings. They have personal, social, spiritual, emotional, mental needs. E is emotional. We need to talk to them so that they can talk to us. Mindful presence needs to always be with us. This was a really important part of the course for me. I really want to be able to help our patients and their families cope with these chronic illnesses. The interventions could include for our 31-year-old client diagnosed with a new paralysis of bilateral extremities to include reinforcing the importance of emotional intimacy and the importance of discussing their feelings, fears, and the stress, and the importance of having a solid relationship based in truth and support. Sexuality and intimacy are critical to a psychological well-being and quality of life. According to Maslow, identifying intimacy is a primary psychological need. If patients and their partners are candid about their experience with chronic illnesses, it becomes clear that the fear of sexual intercourse is only a small part of the intimacy of the couple. Intimacy better describes what patients and their partners are experiencing as they want to have this. And as a team, it may or may not include sexual intercourse. I truly appreciate the delicate way that the author discusses the importance of supporting your patients and your partners through their intimacy and sexuality when dealing with a chronic illness.
Spirituality, according to the Oxford Dictionary, is, quote, the quality of being concerned with the human spirit or soul as opposed to material or physical things. The shift in priorities allows us to embrace our spirituality in a more profound way. According to Chopra.com, religion is a personal set or institutionalized system of religious attitudes, beliefs, and practices. The surface and worship of God or the subnatural beings. Our best practice interventions could include prayer, listening, and talking to the client and their family. Interventions for an 85-year-old client diagnosed with arthritis would include education on the signs and symptoms of an impending asthma attack, and they are crucial. Knowing what trigger attacks will help reduce them. I did love this chapter in which our author discussed the teaching learning process, which is characterized by a multifaceted, dynamic, and interactive exchange that are acknowledged by our client family education and nursing practice. Teaching is a collaborative and inspirational act of communication, especially with our families and individuals in response to their individualized education needs, with the objective of achieving a positive outcome. Learning by comparison assists us to acquire a new knowledge with skills, and we need to be able to analyze and/or look at attitudes that can be measured. As a clinical educator, this is a fundamental basis of my job. But it's not just a job, it's a passion. It's something that drives me to empower my nurses, my patients, and their families to make the right decisions and choices and learn how to manage their chronic diseases. As a mother and a patient herself with moderately severe asthma, I can totally relate to what is going to be going on if you have an attack. You always need to have your rescue inhaler present. Your family needs to understand, and you need to take your maintenance prescriptions regularly. And unfortunately, if you don't, you're going to have a potentially deadly attack. Social support is the social and community relationships that patients develop to aid them in their health journey. Some of our best practice interventions are to assist with the need for social services, including social groups, referrals to specialists, and a personalized care plan. An intervention for a young teenager with depression would be ensuring the teen feels safe and secure in their mental health practice and process, and carefully listening. Skills are going to be totally important. Our author discusses that social support refers to social relationships with family, friends, community, and the healthcare system, which provides valuable or perceived important assistance to healthy people according to our 2023, which we are trying to do through DHS, to support them through a social and community context that affects individual health with their functioning and quality of life and helps them with their risks. Working with people to address their social needs, and determinants of health is crucial to developing plans of care that address those needs that can improve people's health and well-being and help with revenue for facilities, which is very important considering where I work. Nurses need to provide emotional support to the patients and their families to thrive and achieve success. Quote, healthcare professionals can play an important role in transitioning to a safe environment for young adults and their families to talk openly about living with and managing mental illness. Adherence is a complicated topic for healthcare providers as it entails the patient and their family taking the recommendations for treatment of their illness and complying with them. Some barriers to adherence are financial, transportation, lack of quality health insurance. Some of the best practice interventions include assisting the client with adherence, positive reinforcement, mindful presence, assisting with client support groups, and interventions for obesity could include weekly weigh-ins, nutritional counseling with a registered dietitian. When I read the following compliance rates that our author discusses, I was truly shocked. He states that ascertaining the true picture of non-adherence in chronic illness is difficult. Studies indicate that adherence rates in illness is difficult, and it is approximately 50% of compliance, with ranges of non-adherence from 20 to 60% for acute care and those with chronic illnesses. That is very upsetting. Arthur does discuss the culture of disparity for those minority patients living with chronic illness. It is so unfortunate that due to social, economic, cultural, and financial, and perhaps spirituality, these patients do not have the access to adequate quality healthcare. As nurses, we have a moral and professional obligation to ensure that these patients have the proper health care that they are entitled to. It really made me incredibly sad when I read about this. Care plan and the stereotyping that patients experience due to having minorities. I have a son who is half Mexican who I know has experienced this problem and difficulty when he was younger. And when his younger brother was born, who's 10 years difference than him, many people would say, who did you adopt? And I would say, no, they're both my babies. My younger son is from a second marriage who is a redhead with a very pale skin complexion and very different from Jay. The best practices for these families are to ensure that we are giving them access to the community services that they are entitled to. Without them, they will falter, and we will falter as nurses. The chronic care model, as per our author, is, quote, a comprehensive, team-based model that aims to redesign primary and specialty practices. The model includes an essential factors in managing chronic care. The community and the health system, as well as self-management, do support the delivery of the healthcare system. The model does show that it emerged in the 1990s, and it does identify with 3 issues in providing care for those with chronic illness through primary care. The family-centered model of care is based on the family being the center of the interdisciplinary team along with the healthcare providers. As nurses, it is crucial that we acknowledge and honor that this is what the family needs and is the center of the plan of correction, and they do need education and support.